Greetings, I'm Dr. Sherry Wilson of Stride Career Prep's Health Career Program. Welcome to our webinar series on careers in public health. We have 2 episodes for you covering the field of public health, and today we will meet with Commander Crystal Hughley of the U.S. Public Health Service Commissioned Corps. The U.S. Public Health Service Commissioned Corps, also referred to as PHS, is a team of well-trained, highly qualified public health professionals dedicated to promoting the nation's public health, disease prevention programs, and advances in public health science. These men and women serve on the front lines of the nation's fight against disease and poor health. As one of America's 8 uniformed services, they fill essential public health roles within the nation's federal agencies. Key leaders for PHS are Dr. Rachel Levine, Assistant Secretary for Health and Human Services, Vice Admiral Vivek Murthy, Surgeon General, Rear Admiral Susan Arcega, Director of Commissioned Corps Headquarters, Rear Admiral Aisha K. Mix, Assistant Surgeon General, Chief Nurse Officer. This 2-part series provides an overview of the U.S. Public Health Service and offers a glimpse into what it means to be a public health nurse.
Thank you, Dr. Wilson. Again, my name is Commander Crystal Hughley, and for the next few moments, I will share some information about public health, what it is, and the amazing opportunities that are available in this career field. What are my credentials? I'm actually an FNP, which stands for Family Nurse Practitioner. An FNP is a nurse with advanced training that allows them to assess, diagnose, prescribe medication to treat illnesses. FNP services include, but are not limited to, ordering, conducting, interpreting diagnostic and laboratory tests, prescribing medications and non-medication therapies, teaching, and counseling. FNPs can practice autonomously and in collaboration with other healthcare professionals. There are approximately 192,000 credentialed FNPs that practice in the United States alone. As I mentioned previously, prior to becoming an officer in the Public Health Service, I began my career as a registered nurse in the United States Army. I completed a 4-year bachelor's degree program to become a registered nurse. Once I completed college, I worked in areas such as the operating room, medical surgical floor, emergency room, mother-baby unit, and labor and delivery. I cared for patients in all age groups. During my experience in the various areas of nursing, I realized that I wanted to advance my career and become an FNP. In order to become an FNP, I had to go back to school to obtain additional training to earn a master's degree. As I entered FNP school as an FNP student, in addition to taking science and advanced nursing courses, I rotated through various areas of medicine, which included pediatrics, behavioral health, primary care of elderly, just to name a few. I learned how to educate patients and develop treatment plans for chronic illnesses such as diabetes, high blood pressure, also how to care for women prior to and during pregnancy, as well as many other types of patient populations in different age groups. My nursing experience was invaluable with completing nurse practitioner school. I was introduced to many opportunities in public health by a friend who encouraged me to consider the public health service. I decided to research the public health service. During my research, I realized that PHS gave me an opportunity to help families. And because of my experience working with so many different age groups and types of medicine, I realized that it gave me an opportunity to help families that I so enjoyed working with in the past, far-reaching impacts in my local community, the country, and around the world. The public health service was exactly what I was looking for. So what is public health? Public health is the art and science of preventing disease through an organized societal effort. It is the holistic approach to wellness which factors in 4 components that make up the whole person: the heart, the body, the mind, and the soul. The heart is the relationship with family, friends, loved ones, and being generally connected to people. The body is physical health. It's the study of biological science, of anatomy and physiology and cells. All those are needed to care for the organs that encompass the body. The mind, think of the motivation needed to care for the body or the sensitivity to connect to others. A person's mental health or behaviors and habits are all focused within the mind. The soul is how a person connects spiritually and culturally to others. So the heart, the body, the mind, and the soul, this is holistic health. As we look at the roles of public health professionals, we have to consider the many ways a person can enter the fields of public health. There are 3 roles public health professionals can enter public health. One is providing frontline health care to vulnerable populations. A second way is to respond to public health emergencies. In the public health service, officers can contribute according to their specialties. Responding to public health emergencies, all officers can contribute according to their specialties. Some of the public health emergencies include Hurricane Katrina, the Ebola crisis in West Africa, or the current pandemic that we currently are experiencing, COVID-19. Another role of public health professions is to develop policies that affect large populations. A person can enter public health as a physician, a dentist, social worker, or any other professions that care for people and their health. I can speak specifically to my role as a nurse in public health, since that's what I am, a nurse in public health. As previously mentioned, public health nurses protect, promote, advance health, and specifically work one-to-one with patients in underserved areas. Nurses can also work as an administrator to assess needs, identify certain areas that have challenges with receiving care, and develop policies and partnerships to improve health. To become a public health nurse, as I mentioned previously, a 4-year degree in nursing is the basic requirement. A nurse must also pass an exam called NCLEX, which is a national exam all registered nurses must pass in order to enter the field. To again highlight the items that led me to specifically become a public health service corps nurse is the variety of work and structure. A PHS officer or public health service officer, that is possibly a scientist working to help fight HIV, or an engineer that may work to secure clean water, actually wears the same uniform as a registered nurse. This is significant because it shows unity in our effort to advance public health. I do have to admit that there were some challenges on my way to becoming a public health nurse. Although I excelled overall in academics, I ran into a roadblock with math on several occasions. I had to work really hard to pass math classes. Some of the things that I had to do, I had to get a tutor, I had to stay up late and study concepts over and over that a lot of my friends were able to understand very easily. Although I made it through the classes, they were my greatest challenge. When I passed the coursework, it was such a great feeling and honor to put on the uniform and the hat and be part of something greater than myself as an officer in the Public Health Service Corps. So if a student is interested in a career in public health, there are a few things that I would consider. Work hard in all your science and math courses. A lot of the coursework may be challenging, but never give up. When classes seem extra hard, keep pushing. You will get through and you can enter the career field of your choice. Please know that there is a great need in a variety of professions in the public health service. There are 11 categories, and they are all in need of individuals that are interested in providing help to your local community, the national community, and the international community. There are vulnerable and underserved communities across the country and around the world that need your expertise and your interest in helping others. Please consider an exploration of careers in public health. If you would like more information about how to join the Public Health Service, please visit our website, US Public Health Service USPHS.gov. Thank you so much for this opportunity to discuss and careers in the U.S. Public Health Service.
Thank you so much, Commander Hughley, and thank you for your service.
Thank you.
And to our students watching, we hope that you find this webinar informational as you consider a career in public health. Thanks for watching.